Hi, my name is Katie. I'm going to be your nurse today. Can you tell me your name and your date of birth?
Emily, April 5th, 1992.
Okay, do you have any allergies that you know about?
No.
Okay, I'll just check that on your band. All right, so today we're going to be doing a full physical assessment. I'm going to start by doing just a general overview while I'm doing the assessment. I'm going to look at your level of consciousness, your cognitive function, your skin tone and color, as well as your speech and communication. All right, so my first step is going to be looking at the shape and symmetry of your head, and then I'm going to palpate and inspect your head for any lumps or bumps that you're not feeling. I'm going to look at your hair. Next, I'm going to look at your cranial nerve 7. So I'm going to have you smile and frown. This one's hard. Furrow your brows and raise your eyebrows. Good job. And then next, I'm going to look at your ears. I'm just going to palpate the outside of your ear and look at the skin for any bumps or discolorations. And now I'm going to check cranial nerve number 8. So I'm going to stand over here. I want you to tell me what I'm saying to you.
Okay. Gray kitten.
Black bag.
Black bat.
Thank you. Next, I'm going to check your eyes. We're going to be checking cranial nerves 3, 4, and 6. So I'm going to have you follow my pen. And then just follow it in towards your nose. Checking for accommodation. And I'm going to do a pupillary light reflex. All right, and I'm going to look at your sclera and conjunctiva. Okay, and I would document that as perla, or pupils are equal, round, reactive to light and accommodation. Also earlier, we did the Snellen eye exam to check her vision. We did her height and weight, and her body BMI was 21. And then we took vital signs. Her heart rate was 75. Her respirations were 18. Her blood pressure was 120/80. And her temperature was 97.7. Didn't say that earlier. And then next, I'm going to look at your temporomandibular joint. You're going to move your jaw side to side and front and back. Okay. And I'm going to palpate your sinuses. So we're going to do your frontal sinuses. And then, these are your maxillary sinuses, sorry. And your frontal sinuses up here. Thank you. Next, I'm going to look at your nose. I'm looking for symmetry. And I'm going to palpate for any bumps or skin discolorations. And then we're going to check for patency of your breathing. I'm going to close one of your nostrils and just breathe. Okay, and this side. Thank you. Next, we're going to look at your mouth. But first, I'm going to look at let's see if this works, your lips. You open your mouth, sorry, and your buccal mucosa, your teeth, your gums, your soft palate, the floor of your mouth, the uvula, and your tonsils. Next, I'm going to have you say ah. All right, so I'm checking cranial nerves 9 and 10. I was looking at her uvula and her soft palate for that. Next, I'm going to have you stick out your tongue. All right, that's checking cranial nerve 12. I want to see your tongue is midline, which it was. Next, we're going to look at your neck. I'm going to check for any enlarged glands. I'm sorry, your parotid gland, your salivary gland, and your thyroid gland, which I'm not seeing any swelling there. Next, I'm going to check your lymph nodes. We're going to do your preauricular, your postauricular, your occipital there, and then your submental, your submandibular, your jugulo-digastric, your superficial cervical, and your deep cervical. All right, and then your subclavicular. I could have you shrug your shoulders. Thank you. Next, I'm going to have you sit back. I'm going to prop it up to 30 or 45 degrees. Use one more pillow. All right. And then we're going to look for any jugular vein distension. Let me see. Yeah, you can see. And then I'm going to palpate her carotid arteries one at a time, so don't pass out. And then I'm going to listen to her carotid arteries with the bell. Okay, we're going to have you breathe in and then stop. Thank you. Breathe in and hold. Thank you. Next, you can come back over here if you would like. Then I'm going to check neck range of motion. You turn your head side to side, look up and down, and then your ear to your shoulder.
Oh, I didn't do this.
Oh.
Side to side now. You can do your shoulder.
Perfect. See, that's all with your neck. Now we're gonna do your upper extremities. So I'm gonna check your skin temperature and skin tone and color. I'm gonna check capillary refill. I'm also gonna do inspect and palpate her nails. I'm looking at the profile sign for less than 160 degrees. And then I'm gonna feel her radial pulses. All right, and then we're gonna check strength. If we're gonna have you squeeze my fingers. Don't worry about that one. And then put your arms like this. And could you pull back? All right, and then push against me. Thank you. And then I'm going to do range of motion. If you could hold your arms out for 5 seconds. That's 5 seconds. You bend your wrist. You see? Oh, put your wrist up, and then bend all the way around, and then flex and extend your elbows. Thank you. All right, so next I'm going to look at your chest. If I get you to take your cap off. All right, so I'm going to first inspect your anterior chest. I'm looking for any signs of retractions or use of accessory muscles, which I'm not seeing. I'm looking at her posterior chest, which I don't see any issues. Next, I'm going to listen to all 5 lung sounds. And while I'm listening for bronchial, bronchial-vesicular, and vesicular sounds. So you got 5 spots to listen to here. So you breathe every time you hear it or you feel my stethoscope. And then we're going down here. Okay, and then I'm gonna have you stand up and turn around. I'm gonna do the 9 spots on your back. I'm just gonna follow the line of her clavicle right around here. Just gonna have her breathe every time she feels my stethoscope. Just go side to side. Okay. Let me know if you get dizzy or anything breathing. Sorry, getting all up in your
It's okay.
We'll just go right around here. Okay. And then right around here. All right, and then I'm gonna, on the right hand side, I'm gonna have you lift up and I'm gonna listen to the lateral side. So on the right side, you have 3 lobes. So I'm gonna listen like a triangle pattern over here. Okay, and over here you have 2 sides, or 2 lobes. So I'm gonna listen to 2. No, you're fine. And then that is all for your chest. One sound. You can sit back down if you'd like. I have to do heart sounds. So first I'm going to listen for your apical pulse. I want to hear S1, S2. It's a loved up sound. If I hear an extra gallop or anything, it could be S3 or S4, which is what we don't want to hear. So this is on your left side. I'll send over here. Thank you. All right, now let's listen to your arteries. I'm going to do it first with the diaphragm and then with the bell. We'll start with the aortic, and the pulmonic, and the tricuspid, and the mitral. Okay, and then I'm going to do the same thing with the bell. Got the aortic, pulmonic, tricuspid, and mitral. All right, thank you. So that's everything for your chest. I'm going to have you lay down, and we're going to do your abdomen next.
Keep it on.
Keep it off for this one, and then it'll be good.
Lay this way.
Or
Lay.
lay long. All right, I'll get this out of your way. Okay. So first, I'm going to check the contour and symmetry, as well as her skin color and look for any pulsations. I'm gonna check symmetry by going down here. All right, everything looks good. Next, I'm going to, with the bell, listen to her aorta and her renal arteries. Renal arteries. All right, now I'm going to listen to her bell sounds in all 4 quadrants. Those are great bell sounds. Very active. Next, I'm going to do some light palpations just on the surface. Let me know if you have any pain. All right, now we're going to do deep palpations. And that is it for your abdomen. You can sit up if you would like. Next, I'm going to do your lower extremities. I'm going to feel the temperature and look at your skin color and skin tone on the way down. I'm going to look for pretibial edema right here, which I'm not seeing. I'm going to feel your dorsalis pedal pulses. I'm going to check for capillary refill. Okay. And then I'm going to have you lay back down. I'm going to check the Babinski reflex. I'm just going to slide this on the bottom of your foot. I'm sorry if it tickles.
That's okay.
Okay. And then we're going to do range of motion for your hips, knees, legs, feet. I'm going to have you, let's see, can we get it on camera? All right, lift up bend your knee. We'll go back, this way, up, down, this way, back, and down. And could I have you hold each foot up for 5 seconds? 1, 2, 3, 4, 5. Good, 1, 2, 3, 4, 5. And then you could push against my hand. All right, same this way. And push, push. And then push again like a pedal and pull back. All right, and then I'm gonna have you swing your legs over one more time, I'm sorry. And then push back and pull up. All right, now we're checking strength and range of motion. We'll just check range of motion of your feet. If you could push down or go down and back up. Perfect. Next, we're going to do the neurological exam. So have you close your eyes and let me know when you feel my touch.
Feel, 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 feel.
You can put your shirt back on if you like. Sorry, could have told you that earlier.
That's okay.
All right, this next test is gonna be sharp or dull. I wanna let you feel what sharp will feel like.
Okay.
And this will feel dull.
Okay.
Okay, let me know which one close your eyes and let me know which one you're feeling.
Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull.
Okay, beautiful. I'm gonna have you stand up, close your eyes, and just stand with your hands your feet together and your hands to the side for 20 seconds. All right, that's 20 seconds. That was checking the Romberg, or that was the Romberg test. Here you did your Babinski reflex. I'm gonna have you sit back down, and I'm gonna check your bicep reflex. I'm gonna have you like flex your arm, and I'm gonna find your tendon, and then you can relax. And then I'm just gonna check your reflex there. Same thing, I'll find your tendon, check your reflex. All right, now have you sit back on your bed where your feet dangle a little bit. We'll check your quadriceps reflex. Okay, and there, perfect. Now I'm gonna have you, let's see, follow put your finger on your nose, and then you're gonna come touch my finger, whatever.
With my other hand?
With this one.
With this one.
Uh-huh.
Okay, now?
Yeah. Perfect. I'm gonna have you stand up. I'm just gonna have you walk that way a little bit. All right, and then can you walk back doing heel to toe? Perfect. Now I'm going to check your spine. Actually, I'll just lift your shirt for this if you want. I'm going to check the concave thoracic curve and the convex lumbar curve. If you could bend down, I was going to look for the straightness of your spine. All right. You can stand back up. Put your hands on your hips. All right, and you're going to twist and twist the other way. We're checking range of motion. And then if you could bend down, back, and then side to side again. Perfect. And that concludes the exam.
Ah.